morning, good afternoon, good evening, whichever part of the United States you're on. My name is Yannick Hicks. I'm your host for this Georgia Association of Healthcare Executive podcast. You're in for a treat today. We'll have our guest. I'll definitely have him introduce himself, Mr. JC Jones. But my name is Yannick Hicks, and I work with healthcare organizations to help them to retain their employees, reduce burnout, create engagement so they can improve overall patient outcomes. And as your host today, we try to bring excellent guests that will share thoughts and ideas, as leadership thoughts and ideas as far as healthcare is concerned, to help us to achieve healthcare excellence in healthcare, leadership in healthcare. So today we have our guest, Mr. JC Jones with the Georgia Composite Medical Board. I'm excited to have you today. Welcome, Jason. Thank you for coming.
Thank you, Yana. We appreciate you having us. Thank you for the invitation, and want to know more about the medical board, because that's what we want to do, is get the word out of who we are, what we do, and how we can help the citizens of Georgia and the medical professionals that we serve. But I'm Jason Jones. I've been the executive director for 2 years this month. Actually, last week's been 2 years, and it's been a steady 2 years of work, trying to get everything up to date and get everything going for our medical professionals as well as our citizens that we serve. So it's been a daily grind, and we enjoyed 95% of it. Some of it is a little bit trying, but we're getting there. But we 2 years feels like 20, but we're gonna keep going.
That's great. So before we dive in, what made you get involved with the Georgia Composite Medical Board? How did you get started?
Yeah, so my career has been law enforcement. So my adult career since I was 20 has been law enforcement related. And one day I saw an advertisement for the Georgia Composite Medical Board criminal investigator position. That was years ago. I applied, got the job, started working as a criminal investigator for the board. Thoroughly enjoyed it. Just the work that we did as far as helping with complaints that citizens have, during their medical appointments, procedures, whatever. We were able to, help out the citizens with that, and we were also able to regulate the medical profession in a way that I wasn't used to in regular law enforcement. So that was my first taste of it, was being a criminal investigator. Well, I later moved on to another state agency to be their deputy director over criminal investigations. Then a few years later, had an opportunity to come back as the medical board's executive director. They needed some help in staffing, leadership, getting things on track for the future. So after much prayer and talk and understanding, I took the position 2 years ago, and it really is a meaningful position to be in, to be able to help out and get things right. But that's how I became the executive director, was just through my experience and then knowledge of others that knew that I had that experience, and they invited me over, and I said yes, and been here for the 2 years.
Excellent. And you're already doing an incredible job. I know we had, we were able to have a meeting before this, got to know a little bit about you, and I just actually also found out I have a medical background, but I had never heard of Georgia Composite Medical Board, and it's great that you're able to come in now, educate us with the healthcare executives and all the people. For those who may not understand, just if you don't mind, share with us, kind of briefly explain the role of the Georgia Composite Medical Board and its mission in protecting the public.
Yes, sir. So you're right. A lot of people don't know what the Georgia Composite Medical Board does or is, and they didn't know we were a state agency. But what we do is we regulate the practice of medicine in the state. We have a board comprised of 15 members and one ex officio member. They're the ones that do the technical side of the medical practice act. So staff-wise, executive director and staff-wise, we handle day-to-day operations of licensing of medical professionals, complaints that come in, investigations, customer service. We provide those services as a staff, but the board itself meets every month, and then they handle the technical issues with the medical professions, the questions that doctors have, or that respiratory care professionals have, or advanced practice registered nurses. If they have questions about the practice, we go through the board and we make the rules. And we have legislation that we're doing this year as well. So we're actively involved in the practice of medicine in the state. And, we oversee, we changed our mantra. Our slogan is license, regulate, educate. So we do those three things, and we missed out on the education for a long time. So we're rebuilding that so that people understand what we do, and we're able to push changes or updates out on a regular basis about the medical profession. But the ultimate goal is that we want to protect patients. So by doing all of this, by licensing, regulating, and educating the medical profession, we're protecting the patients, because we're getting the good medical practitioners in, and the ones who may not be so good. We have ability to sanction a license or revoke a license or put them on probation, those type things. But our main goal is patient safety. Everything we do revolves around that.
Having a medical background, as a pharmacist myself, I just love it because the reason why we got into this profession is patient safety. How do we improve the outcome? And having that patient-centered approach to what you guys are doing, it's really incredible. Helping the profession, helping the patients. So thank you for the work you're doing. So what leadership challenges come with overseeing medical regulation in a rapidly evolving healthcare environment?
What you just said, the rapidly evolving environment. I mean, it changes daily. There's things that happen daily that can affect regulation, rules and laws. If an incident happens to a patient that's never happened before, then we got to figure out how we're going to react to that and adapt to that and help fix that for future generations of patients. So just having the vision and the openness of understanding the ever-changing environment is key. That's a leadership challenge that I have to be aware of, and that my team has to be aware of, so that we can identify these things, pull them out, and then do something about it, and not just let it linger. And that's hard, because it's among the other challenges we have with licensing in a timeline, regulating in a timeline. We also have to be wary of what's going on out in the communities, in the medical clinics and offices. So, we're trying to keep the standards current without overcorrecting a lot. So you want to set standards, but you want to also, it's a practice of medicine. So you want to make sure that the practice is still there. And it's not just, you have to do this. You want to give that autonomy to the medical professionals as well. So that is a leadership challenge, because how do you do that? By not being a medical professional. I'm not a medical professional. That's why we have a board that helps with that. Balancing access to care with public protection. So, we have med spas on every corner of the state now. We have hydration clinics on every corner. We have ketamine clinics that are coming up. How do we balance that access, but also regulate that profession where, the standards are met, but we're not overreaching and being a totalitarian government agency. So that's a management or a leadership challenge. And then the complexity across professions and practice settings. So we regulate 11 different professions, and each of them are different. Each of them have different aspects. We don't regulate nurses, but we regulate the advanced practice registered nurse protocols. So we can't sanction a nurse, but we have oversight over the protocols that they have with a doctor. So how do we delicately maneuver that? Because we have to work with the nursing board to make sure that if something does happen, we let them know. So leadership challenge in there is just working with other agencies to make sure that we're regulating the profession properly without overstepping our bounds as well. And then data transparency and operational performance is a leadership challenge, because you can't get anything without data. Well, you got to have a means of getting that data to be able to get, let's say, money from legislators to be able to do more for our medical professionals and our citizens. So leadership challenge there. How do you delicately maneuver that when the political process is very ever changing as well? So you got to stay current on that and make sure that you're aware of things that are going on, and then just keeping up with the emerging risk areas, impairment issues. Do we have proper items in place for, let's say, the professional or the physician health program? Is there ways for, if somebody is impaired, how do we get them back on track? That's leadership challenges. Just fraud in the medical industry. How do we keep up with that? I mean, there's so many aspects to the medical board and the practice of medicine that most folks aren't aware of, and it's kind of hard to relay that. And then just working with the complaints that come in. How do we triage those with the amount of personnel that we have? We can't investigate or look into everything, so we have to kind of triage that. And that, how do we mitigate that when somebody's upset at us? So there's a lot of things that go on as far as leadership. And then your personnel, how do you motivate them in it's a production environment in a way, but how do you keep them aligned with, it's not paperwork, it's people we're helping, whether it be an applicant who wants their license, or whether it be a citizen who has a question about medical practice or a complaint. How do you keep your team and staff on that trajectory and vision of keeping the people the priority and not the paper? Because we get so caught up in workday and we have to get this done. How do you do that? So we deal with that on a daily basis, a weekly basis, and it's up to me as the head of the agency to keep that on track. But I have a good team here that helps out with that, and it's people you surround yourself with. So leadership challenges, I think it's the same as every other environment. We believe in servant leadership. I try to teach servant leadership here. We go to trainings to make sure that we're addressing that and that we understand servant leadership, because that's what we are in a government agency, is we servants of the public. And sometimes that's lost within government, but we try to keep that vision alive. We're serving others, and let's keep that as a focal point. So there's a lot that goes along with it, as you can tell.
Yeah, I think that's just so incredible. Knowing that, even though you're involved in the regulatory space, I love that when you said people over paperwork, and that's so profound. I think that was 2 days ago. I did a virtual presentation to the Healthcare Compliance Association, and these are all compliance officers and regulations and compliance. Yep. And that was one of the things I was wanting to pass home, that even though you have to make sure that ethical responsibility and compliance, you have to understand that people over procedures or people over policies. And if you take care of the people, they'll take care of the policies and the procedures and all the things. You have to have the right perspective. Failure to do that, then you have people doing unethical things, and you have increased errors. And
that's exactly right. Just remember the people that you're. I look at it as a family member. What I want my family member to have to go through that. What I want my closest friend to have to go through that. So if you keep that mindset in leadership, you're going to lead people in the right way. It's when you lose that and you just think, I got a number to get, or I have certain criteria to meet, then you're going to lose focus on being a leader in this environment and in government. So we constantly think of that, and we constantly remind each other, hey, remember the people behind the paper. That way, we're all keeping each other accountable here, and I have good leadership, teammates that keep me in check and make sure that we're doing this. So it's a team effort to get it all done. But again, people are who we work for, and people are who we want to make sure we're taken care of.
Wow, excellent. That is incredible. And we're making before. So what should healthcare executive know about risk exposure and compliance trends in today's environment?
So, we try to educate as much as we can on the medical profession in Georgia, but we're limited on what we can do. I mean, there's thousands of medical professionals in Georgia, and across the states that are licensed in Georgia, and it's we can provide information, but it's up to them to make sure that they're abiding by things and getting the updates and coming to our website and coming and just reading the different things that are happening to stay current. We can try to do that all day long, but if they're not reading the emails, reading the things that are coming out, then they're not getting the information. So I think just understanding the operational compliance of their profession. So go read the rules, go read the laws, make sure that you understand what credentialing is about, and make sure that you understand what's involved in that profession from a regulatory standpoint, and a regulatory body really helps. And then just making sure that you have the proper supervision over your licensed professionals is a big help. If you understand what their job is and role is, then you understand what you're looking for as far as the exposure and compliance risks that may happen if they don't do what they're supposed to do. And make sure you have policies in place that show what their duties are for that particular profession. It's just, and then document the things that happen. If you don't document it, it doesn't happen. And then, that's important. So medical professionals deal with controlled substances as well. And that's, you have your PDMP, which is the Prescription Drug Monitoring Program in Georgia. Make sure your physicians or medical professionals who prescribe are looking at that when they're examining patients, to make sure they're not giving a prescription they shouldn't. I mean, there's steps in place. They just have to know it, teaching it. The oversight is important with any profession. I think if they have good oversight in place, they can keep track of the exposure to the risk and compliance issues, the compliance trends. Telehealth is big. So telehealth is getting bigger, and Georgia, of course, has a telemedicine license that someone can get. Just knowing what that doctor-patient relationship is, making sure that they're even a nurse or an APRN who may have that, make sure they understand what that relationship is within their profession, so that they're not, prescribing or telemedicine when they should be physically seeing that patient. And just know the rules of that. I mean, it can really get you in trouble with telemedicine if you're not doing the correct thing. And, in Georgia, we have APRN protocols that physicians sign into with an APRN, and gives them the permission to prescribe or do certain procedures. In telemedicine, there's restrictions on that, and we get a lot of questions about that. So just knowing what you can do as a telemedicine with an APRN protocol, that's something that I think is really big. And, just the delegation of things from one physician to another mid-level, you have to know what you're delegating. You have to have a relationship with that person. If not, that's operational risk right there, because the APRN can go have a private practice somewhere, which isn't allowed in Georgia. We're getting a lot of that. So just knowing the rules and laws, I think, is really key, and then setting those procedures in place around those rules and laws of that state is key. If you don't do that, then you're bound to have an issue at one point or another.
Wow.
Organizations that do best are the ones that can show they operate with clear accountability, measurable controls, and documented follow through. If you can do those three things, you're probably going to be good with us. And we wouldn't have to, we wouldn't have to come down on a regulatory basis. We just be there as hey, you're doing great, So there's things you can do to keep that under control from our perspective.
Wow. Yep. If you don't document it, it didn't happen. I mean, that's very critical healthcare. As we're about to making the wrap it up, and then you give your final thoughts. By the way, this has really been incredible, enlightening for me. Learn more. By the way, what do you like to do for fun? Just trying to. What do you apart from?
Well,
what do you like to do for fun?
I like to work. I think work is fun, and that may not be for everybody, but I actually like solving problems and making sure that things get done for people. But on the fun side, I do golf and I do fish. I like to just relax sometimes and not have to think. That's fun. But I do like to work. That is fun to me. I spend time with my family. We go to the beach.
Okay.
I like the beach. Just sitting there watching dogs run on the beach is probably my best pastime. But just simple things. I like simple things just to relax. No skydiving. No bungee jumping, nothing like that. Yeah.
Yep. I love that too as well. I love to just relax the beach and just put all the problems aside and and just focus on the moment.
That's right. Listen to the waves and feel the breeze.
Absolutely. So this is incredible. So what is one final thought that you like, the healthcare executives, member in this healthcare, what will be your final thoughts that you have for us to take away with as, regarding the, Georgia Composite Medical Board?
I think, from the heart, I think just remember we're taking care of people, and that medical executives, you're also taking care of people, whether it be your staff, whether it be the patients, whatever it is. Remember people first, take care of people, and all things else will work out. But from a GCMB, Georgia Composite Medical Board standpoint, just remember what those professions in those medical environments have to do. Make sure that they understand what they need to do and that they understand the rules of their profession and the laws of their profession, and that they keep up with that, and that if there is an incident that happens, that it is reported, so that we can handle what we need to with that professional, so that professional doesn't move on to another spot and do the same thing. I think reporting any incident is key for us to manage the professionals in this state, to make sure that the patient care is there. And then just executives, just remember what you're there for, and that's the people that you serve. So we do the same thing, and the medical board's here to help. So if anybody that listens to this has some questions or needs any help, just contact us and we'll be there. So.
Yeah. How can they contact you?
So we have our website. So if they go to our website, it'll have everything they need on it.
Okay.
My information is on the internet. So if they look up Jason Jones, Executive Director of the Medical Board, they'll find my cell phone number and email. So we're easily accessible. We just get a lot of correspondence, but if it's something urgent, there's a way to get a hold to us.
Excellent. Well, Jason, this has really been incredible. I really appreciate you and the work that you're doing. I mean, having a background in criminal investigation and law enforcement, and then utilizing that to help to protect the public, protect the people, and being that liaison, between the medical practice and the community. It's quite impressive. So I really want to thank you for taking the time and educating us and sharing with us the role of the Georgia Composite Medical Board. I really appreciate you. Thank you very much and stay blessed.